as more patients with COVID are admitted to hospital, there's real concern about the nursing workforce, and that's prompted this push for COVID bonuses to be paid. Dr Tim Reid is the Victorian Greens health spokesperson, and he joins me now from State Parliament. Thanks so much for your time this afternoon. It almost sounds like danger money that needs to be paid to nurses. How much are we talking about, and who would be eligible?
So we'd make this eligible, Alicia, for staff earning up to $90,000, and it would be nursing staff, other clinical staff, patient care attendants, ambulance officers and psychiatric nurses, anyone who is face-to-face with patients in the public hospital system over the next few months.
And the bonus, I understand, is what, about $9,000 paid over 6 months. Do you know what the total cost of this package would be for the state government?
Yeah, so it would be up to $9,000 depending on their income, with a sliding scale reducing it for those earning more. And we haven't got the costing back yet, but I would estimate it would be something in the $500 million range, certainly a few $100 million. A lot of money, but to put it in context, we're talking, half a kilometre of the North East Link here.
What are clinical nurses telling you about their current workload?
Yeah, so we're hearing it's really hard work. They're wearing these stifling N95 masks. You can't take a drink while you're wearing one, turning patients, and it's emotionally draining as well. They're struggling to breathe, dealing with distraught relatives. It's hard and often unrewarding work. We're not talking about the highest paid workers in Victoria here. And we've lost nurses who've gone off to vaccination centres and testing sites, often somewhat easier work, a bit less demanding, and paying high casual hourly rates. So we actually need to get nurses back onto the wards for the next few months, now that we've passed the 500 patient mark.
I guess the question is, will money be enough to retain them or to recruit them back, do you think?
Look, it's one thing we can offer now. You can't wave a magic wand and create a nurse, but at least what we can do is reward the ones we've got, hopefully draw in some who are perhaps working reduced hours or working elsewhere. And let's face it, it adds a bit of weight and meaning to all those empty platitudes about frontline heroes that we've been hearing for 18 months, because it's crunch time for the hospitals now.
Dr Reid, I wanted to ask you about other frontline staff. What about our paramedics? They might be asking, well, should we be paid this money as well?
Yes, we've included them in the costing, and you're absolutely right to raise it, because it's not a hospital crisis alone, it's an ambulance and hospital crisis. We've seen what's happened with long response times for ambulances, average 59 minutes last month in Sydney at one stage. We don't want that to happen here in Victoria, but with over 500 patients now, that number is set to double over the next week or two, and it may well continue to rise. So if ever we need to put money in the public hospital system in the last 50 years or the next, it could well be the next few months.
Yes, I think you'll have many people agree with you on that point. Negotiations, I understand, for Victorian nurses for their next wage deal, it's not due for another 2 years. I think in November it will be 2 years. The money for this, of course, would have to come from somewhere. Have you given thought to that?
Yes, the federal government is paying 50-50 public hospital costs at the moment, but they've capped increases to about 6% a year. We think they should lift that cap, and in the end we're paying people hundreds of dollars to sit at home and do nothing. The least we can do is find the money right now to pay our lower paid hospital staff for their efforts between now and early next year.
All right, Dr Tim Reid, we heard the Premier a little earlier in the bulletin. He hasn't ruled it out. He didn't approve it yet, but we'll wait to see whether something comes of this. Thanks so much for your time.
Thank you.